Okay, everyone, so this is the last part of our lecture on female reproductive physiology. We talked about oogenesis and the follicles and how there's polar bodies generated, so you only end up with one mature oocyte. We went through the follicular phase, ovulation, and then the luteal phase. And now we're going to talk a little bit more in depth about menstrual periods themselves. So remember that day 1 of the cycle, the beginning of the follicular phase, coincides also with the beginning of the menstrual period. So, menses. So why even menstruate at all, right? So you gotta love Will Ferrell. It's like, why periods? Why can't Mother Nature just text her and be like, what up, girl? You ain't pregnant. Have a great week. Talk to you next month, right? So why go through this whole process? So there has long been this feeling that there's some type of cleaning out of the uterus that happens, right? That it's important to keep the uterus clean, to kind of shed and empty it out once a month, basically to kind of wash it out. So that's called the hygiene hypothesis. And actually, it's not true. So it doesn't, you don't need to have monthly periods, and your uterus will still be just fine. The uterus is normally sterile. So we talked about the vagina is not. The vagina is normally populated with lots of bacteria, primarily lactobacilli, but there can be other organisms there as well. But that cervical mucus usually keeps any bacteria out of the uterus, with exception of some sexually transmitted ones that are good at potentially sometimes getting up through there, like chlamydia or gonorrhea. So in normal times, the uterus is completely sterile. There are no bacteria up there. There's no reason to have to wash it out. So the hygiene hypothesis was what people thought for a long time, but actually we know now that that's not true. So another one of the hypotheses why we do this is the energy conservation hypothesis. So it turns out to build that thick endometrial lining and maintain it takes anywhere between 300 and 500 extra calories a day. So that's a lot, right? That's like 20% of your daily caloric requirement extra, right? So that would require a lot more food intake, which historically and evolutionarily, we wouldn't want to have to maintain that all the time unless necessary. So the energy conservation hypothesis has some good data to back it up that this might be part of the reason why we get rid of that lining instead of just continuing to maintain it for the next ovulation. There's also this idea that it helps signal fertility. So one of the readings for this week talks about a Dogon tribe and how they use menstrual huts as a way to, among other things, signal who is having regular periods. Because if someone is having periods every month, you know that A, they're probably still fertile, right? They haven't hit menopause yet. And B, they're also not pregnant. So this is somebody that you could get pregnant, right? So it signals that they are fertile. So that's a really interesting hypothesis as well, and there might be some validity to that. There's also this idea that it's really hard for the sperm to swim up through the uterus and out to the fallopian tubes where the egg is going to be located when the endometrium is really thick and in that secretory phase that we see during the luteal phase of the menstrual cycle. And so this idea that the endometrium has to shed so that the sperm have a chance of getting through. It's an interesting idea. It's a harder thing to test potentially, so I'm not sure. It's an interesting idea. All right, so it's not the hygiene hypothesis. All right, it probably is saving energy, right? There are a lot of definitions for the ways we talk about periods, and we're going to practice with these in class. So I just want you to hear me describe them. So menarche is a word that we use to refer to the age at which someone has their first menstrual period. Lots of female-bodied people can remember that day. It's a significant event in their lives. Average age in this country is now around 12. It's actually a little bit lower than that. So you remember from our lecture on xenoestrogens that female-bodied people are starting menstruation earlier now than they ever had before in history, in part because we get better nutrition than people at almost any time in history did, but perhaps in part because of the estrogen-like activity of some of the pesticides and plastics that we're all exposed to. So menses is just another word for your period. And of course, cycle day 1, just remember that first day of bleeding is day 1. That's day 1 of your bleeding. It's day 1 of the menstrual cycle. It is officially the beginning of the follicular phase. We will often in medicine use LMP. LMP stands for last menstrual period. Now what's important here is that we are asking for the first day of bleeding, day 1, not the day that their previous period ended, but the day that the previous period started. Okay, so that can be a source of confusion for lots of people. Cycle length is the time from the start of one period to the start of the next. So remember, our average cycle length is 28 days, but it can vary a lot. So cycle length is the time from day 1 of one period to day 1 of the next period. Duration is the duration of the menses themselves. So how many days are you bleeding? Flow is how heavy is the bleeding. And then regular versus irregular refers to the cycle length, so that interval of time from day 1 of one period to day 1 of the next period. If it's pretty much the same from month to month, 29, 30 days almost all the time, then we would call it regular. But if it varies a lot, then it's called irregular. So again, average cycle length is 28 days. So regular, it's pretty much the same, right? From day 1 of one period to day 1 of the next period. Irregular is if it varies, if it's not consistent from month to month, if you don't ever really know exactly when your period is coming. And it could be irregular in that you have periods really frequently, right? We would call that polymenorrhea. It can be irregular in that you have them infrequently, and we call that oligomenorrhea, because oligo means few. So if you've heard of like an oligarchy, which is ruled by the few, oligomenorrhea, few periods, menorrhea is periods. And then amenorrhea, a as a prefix means without, so that's an absence of periods for 3 months or longer. So the average duration of bleeding is usually anywhere from 3 to 5 days, but it can vary a lot. Some people only have 1 day, some people have 10. The average flow can also vary a lot, and you have to keep in mind that what is shed is not just blood, but also endometrial tissue and other fluids. And it can be anywhere from about 1 to 8 ounces. So I've kind of shown you with the arrows, like these are all potential amounts of menstrual fluid loss that people can have, so about 30 to 270 mLs. If most of that was blood, which occasionally it can be, that can be up to 5% of your total blood volume. So in some cases, if periods are really heavy, if the flow is really significant and heavy, that can be problematic and end up causing low blood counts or anemia because you lose so much blood from your periods. In fact, that's not all that uncommon. And so we have a special name for heavy menstrual bleeding where the flow is more than 80 cc's of blood and fluids per month. We call that menorrhagia. It's a weird word, menorrhagia, heavy periods. Periods can also be painful, right? So we talked about that middle layer of the uterus, the myometrium, that will contract to help expel that shed and broken down endometrium. And in some people, that muscle really kind of goes crazy. And it's almost like you're having Charlie horses in that muscle, right? It's cramping up on you. And so it sometimes can cause severe pain. We call that dysmenorrhea. So remember, menorrhagia is heavy periods. Dysmenorrhea is painful periods. And most people who have periods will have pain with them to some extent. In the vast majority of people, it is mild, but in some people, it's really severe. And so we would call that dysmenorrhea. And interestingly, the pain might be in the lower abdomen and pelvis, kind of where the uterus is, or sometimes that pain can be located in the lower back. And that has to do with how the nerve endings to and from the uterus enter the spinal cord. So it's a phenomenon called referred pain. Similarly, if you've ever heard someone talk about back labor in childbirth, that's the same thing. So sometimes when your uterus is experiencing pain, you don't feel it where your uterus is, you actually feel it in the low back instead. Okay, so that's it for periods. It's the shedding of the endometrium, which happens at the beginning of the next menstrual cycle, so the beginning of the follicular phase. It serves a role in terms of fertility signaling for societies, but probably evolutionarily it was most important for energy conservation. We talked about the terminology, things like day one of your cycle, what's the length, right? The time from day one of one to day one of the other, as well as regular versus irregular. Typical flow, and cramping due to that myometrium. All right, next time, our next lecture will be about abnormalities of the female reproductive system.